communication techniques. Evaluate these 2 vignettes for different therapeutic techniques and communication barriers. Consider the patient's response to each encounter.
Come in. Are you a nurse?
Mrs. Miller, I am a nurse.
Can you get me some pain medication? That other nurse last night was just awful. I only saw her once at the beginning of the shift, and I'm really, really uncomfortable. And I just don't feel good at all. Is there any way you can give me some relief?
Well, first off, I need to do a complete assessment on you before I give you
How long will
payment.
that take?
20 minutes. Because
Well-
I'm very busy, and we have
But
other patients.
I'm very uncomfortable. Is there any way? She didn't do anything for me last night.
All right. Well, on a scale of 1 to 10, 10 being the worst pain you ever had, 1 being no pain, or 0 being no pain, where's your pain level?
8 or 9, maybe going more. It's just, I haven't had anything to give me any relief. I haven't had any sleep last night. I kept buzzing the buzzer and she just wouldn't come in. Well, can you do anything for me?
Let me go check your medication orders.
Can you please hurry?
Well, you're not the only patient I have today, so I will do it as fast as I can do it.
I hope so.
All right, I'll be back.
If not, I'm going to talk to your supervisor.
Okay, well, I don't think that's really necessary.
It may be, I hope not.
Okay, well, I will go check right now for your pain meds. I'll be back.
Thank you. Come in.
Hi. Mrs. Miller, you were resting. I didn't know if I wanted to disturb you or
I
not.
almost went to sleep there for a minute. I
Uh-huh.
couldn't believe, because I didn't sleep very well last night at all. I was up most of the night. And so after you gave me the pain medicine, I felt a little bit better. I almost nodded off.
Oh, well, if you need to nod off, go ahead and we will
Well,
just,
I probably won't, because they're gonna do it for some kind of procedure.
they are, this afternoon. You're gonna have that biopsy done, so
Mhm.
they'll come and get you and take you down.
Yeah, I hope that'll be okay.
Okay, are you clear on everything
Well,
for the procedure?
will it hurt?
Well, they'll put you to sleep. We had talked before, you took your little nap, they will put you to sleep with anesthesia, and it should not hurt during the procedure. After the procedure, there could be some pain, but when you get back to the floor, and also right after you get out of surgery, the nurses in the receiving room will make sure that you're medicated, and we'll get you back to the floor, and I'll make sure that you have your pain meds.
When will we know the results?
They take a couple days, and so your doctor will receive them, and then he will be sharing those with you.
Okay, I'm just kind of worried. I mean, I just don't know what's gonna happen.
Yeah, I'm sure it's not a easy thing right now. The unknown is always a bit scary, isn't it? It is.
It really is.
Okay.
And I don't want to bother anybody, but I just, it is kind of scary.
It is pretty scary. So we'll just hang in there, and I'll be here today again to care for you, and I'm on tomorrow as well.
Oh, that's wonderful.
So, and I'll be sure to express to the night nurse at shift change that you have some concerns about this.
Is the same nurse on tonight?
I'm not sure, but
Because I didn't like her at all.
You didn't.
She was rude, she was rough. I just wanted to throw the pitcher of water at her.
Really?
Yeah, I mean, she didn't come back. When she did, she just stuck her head in and left, and I don't know why she calls herself a nurse.
So you felt like you maybe weren't cared for very well?
Oh, no, I wasn't cared for at all. I mean, she came in and she did a really quick kind of up and down thing, and it was really rough. And then I asked for some medication, and she didn't bring it back, and she stuck her head in and said, "Glad everything's okay," and went back out again. And I yelled for her, and I buzzed for her, and she never came back at all. I mean, and I couldn't sleep, and it was really noisy. I don't know, there was a bunch of noise down the hall, and, she was just awful. I mean, it's terrible. She's one of the worst nurses I've ever seen.
No, I am so sorry that happened to you last night, and I'll be sure when I give a report tonight to whoever that nurse is coming on, that your needs are met.
Well, thank you for being so good.
You are welcome. You're welcome, because it's hard enough to be in the hospital, let alone have all that other stuff going on.
Yes.
Okay, all right, so I'll be back. You try to rest, all right? Anything else you need?
No, I think I'm just gonna put the bed down.
Okay, all right, your call light is here in case you need us.
No, I can't have any water or anything, right?
Not right now, but I'm gonna go grab that other pillow real quick for you, and I'll be right back.
Thank you.